Erin, do we have you back?
Okay.
We lost you.
Sorry, we did not hang up on you.
We were vamping for a few minutes while we were waiting for you. But I want to ask you this question because we do have a few more minutes, so hopefully you can spend a couple more minutes with us. But in the couple minutes we have left, I wanted to ask you a quick issue that I know we can.
Hillary. No.
Well, but I want to ask you about a quick issue in the 5 minutes we have left, and I'm sure we can solve, and that's healthcare. I'm sure we can solve that in 5 minutes, right?
It's a really complex question, I'm sure. But we'll try to fit it in 5
Let's
minutes.
just to get it framed. So, give me the argument for the market-based solution to healthcare, the healthcare problem that we're having in this country that we've had for a while, as opposed to say a either single payer approach or more of a blended approach that kind of creates blends some subsidies and pricing controls along with the market. What's the argument for a pure market-based solution?
What I would like to see would be, the ability to purchase insurance across state lines. What I would also like to see is tort reform, free market solutions put in place where, and I have to mention this because this is the part that kind of blows people's minds. What do we want for Americans? What do we want? Government health care at its best? Look at the VA. Okay? Do we want that for everybody? Because it sure is not serving our veterans appropriately. What I would like to see is even for veterans to be able to use our free market solutions and open healthcare programs and have access to care outside of the VA, and be in a position where there are options. As we've seen with Obamacare, affordable health care is like, it's fake. Their Affordable Care Act was, so everybody would have insurance. Insurance does not mean quality care, does not mean affordable care. I believe that we have to look at the big picture, make insurance competitive. I know people who have, for example, plug your ears, ladies and gentlemen, if you don't want to hear something. I know people who are paying for birth control coverages when they don't need birth control coverages, men and women. Mm-hmm. And why are they, forced under some Obamacare regimens to be able, to pay for those coverages? We have to open up insurance to be in a position where it serves all of the populace, and not everybody may need the same kind of coverages. And there may be some individuals who need more coverage than others. There may be people who have pre-existing conditions that they could, or maybe they couldn't have prevented, that need extra coverage. And of course, you want to make sure that there, discrimination and disqualification by insurance abuse and other things is taken care of as well. I get we need infrastructure in our health system, but remember, gentlemen, more government is not necessarily the answer. And I believe that if we can let the free market work alongside of the structures of government and find a good balance, that maybe in 1 or 2 revisions of health reform, that we might be able to be in a place where we're seeing the health market, be able to work for Americans again. Premiums decrease, deductibles decrease, and see some more innovation in our health system. And that would be a positive improvement. But again, I don't think there is any quick fix. I would like to see the repeal of Obamacare. I would like to see some provisions put in place, maybe for safeguarding of insurance abuse and overstep. But other than that, I think
you're dating our show. You're dating our show way back.
Yeah.
So Obamacare was a bipartisan bill. It went through all the committees, all the bipartisanness. It was a Romney Maryland bill.
Not one Republican voted for it.
It passed the Senate. It passed all this stuff. Now they did have Republicans on those committees, and they did go to Republicans as part of the deal.
Voted for it.
Well, the deal that did not pass that the Republicans can take care of credit for, the deal that did not pass, they worked solely in the back room only with themselves and didn't even let Democrats, they didn't even take it to committee. And that deal fell through. If you get into the Senate and we try health care again, will you allow Democrats a seat at the will you allow Democrats a seat at the table on a health care bill?
All parties should have a seat at the table, and they need to start serving the American public. That's what it comes down to, is they have to serve the American people and the public. Socialism never worked. Free market works. How does government have a role? Let's look at what's balanced, what's right, what's equitable for the American people, for the taxpayer, and let's get something done. What we're seeing right now is kicking the can again. It's got to stop.
But I mean, but just to put a point on it, I mean, we can't have a healthcare system where people in this country can be as healthy as they can afford to be. I mean, there needs to be some level, and you mentioned it, I think I give you credit for that there is a level of government involvement that you need to have there.
Well, you can't have insurance companies, abusing the system, or, a situation where doctors are abusing the system. Right now, we need tort reform because there are all sorts of crazy lawsuits going on. There has to be some level of safeguard there. But what's the balance?